to do that. So thank you. And I'm going to take a couple of questions of the participants that we have here. The first one is, we are going to keep it brief because I think we are already over the time. So I have a few important questions that I'm going to touch upon. Pediatric onco nutrition, are we going to have anything?
Yes.
during
Yes.
the course?
So the
Yes.
pediatric oncology sessions are going to be taken by pediatric oncologists.
Oh,
And
wow.
also yes. So, and also transplant surgeons. So pediatric oncology itself will have around 3 sessions,
Mhm.
2 of which are taken by pediatric oncologists and BMT transplant surgeons, transplant doctors.
Mhm.
And there will be a nutritionist trained in pediatric oncology who will be giving inputs on nutrition as well. So
Mhm.
yes, there will be content on pediatric oncology nutrition.
That is good. So, so coming back to the criteria question, are PG diploma in nutrition candidates eligible to enroll into this course?
Yes,
Yes.
yes. So
Okay.
we want to keep it open to anyone who has a passion to work among cancer patients.
Mhm.
Uh, Cancer nutrition is a specialty by itself.
Mhm.
Anyone who wants to work among cancer patients to improve their quality of life is called to do so, finds it like their service or quality or
Mhm.
a calling, they should join in.
Yeah.
However,
Mhm.
cancer nutrition, we will be going deep into biochemistry and metabolism and also inflammation. So if it is just on a graduate level, it might get difficult. So at least they might have to read up, if they don't understand.
Right, right. And I'm sure you guys are always
Yes,
available too.
but
Yeah.
there should be a basic on nutrition. They should have some understanding about nutrition
Mhm.
before we train them into cancer nutrition. So we can take in students with PG diploma in nutrition and dietetics.
Okay, yeah, that's good to know. And also, there's another question on the attendance. I know we talked about having classes, recorded and given, but does that mean that it's okay not to attend the classes, or is it mandatory to be in the class? That's a good question. Whoever
It
asked.
is good to be in the class because the many of the topics are taken up by oncologists directly. So if you
Right.
have a question, you can hear it from the horse's mouth in terms of what to do and what not to do.
Right.
If for some reason you are not able to attend, then of course the content is available online and you can go through it
Mhm.
and shoot out questions to us and we will get back to you. But we want the sessions to be interactive. That is the reason why a lot of oncologists have signed up to take the lectures for the dietitians, at least from the clinical point of view, medical point of view.
Yeah.
Nutritionally, there will be a set of nutritionists who will be coming in. But
Mhm.
if you are there in the session, it becomes easier for you to ask your question, get it answered, rather than, hear it, make notes, and then, yeah. So we
Yeah,
would
yeah.
encourage as much as enrollment. I mean, whoever gets enrolled, attend as many as possible.
Yeah.
If you cannot because of some other commitment,
Mhm.
then you attend the recorded version of it.
Yeah, yeah, I do encourage you all to
Yeah.
attend it in person because it's going to be extremely insightful hearing from them than just attending a session
Right,
that is
right.
pre-recorded. It doesn't have that feel and that learning experience. So
Yes.
try to
And a
attend it.
good set of faculty. We have Vanessa
Yeah,
who
yes,
has given in so much of inputs.
I know.
Like Vanessa, we have a few very good nutritionists who are having good amount of experience in oncology, nutrition.
Yeah.
And we have a whole lot of oncologists. Like we have medical oncologists talking about immunotherapy and
Mm.
how nutrition impacts. We have transplant physicians, surgeons who are involved. We have surgical specialized like head and neck surgeons coming in for taking sessions on head and neck cancers. So we have super specializations happening and faculty coming in,
Mm.
a whole lot of different faculty. So it'll be great to interact with them because we
Mm.
don't hear much from them otherwise. So
Mm.
it'll be good if you can attend, hear from them, learn from them, ask them direct questions,
Mm.
basically, connect with them.
Yeah,
They're a
yeah.
good group. The faculty is a good group.
Amazing. Yes,
Yes.
I know. There are many more questions that came up on the chat. We're going to answer all of them. We'll take all the questions and we'll get back to you. I'll pass it on to Esther and Vanessa, and then once they get back to me, we will share all the answers with you. But as we are, closing out this session, I just wanted to give a brief overview of everything. Like, it's such a wonderful course. It's super exciting to hear everything that you both have said. the way it is designed, the way, we have involved so many other healthcare professionals in teaching the course, the tools that you have designed, the duration, the criteria, the eligibility, everything I think has been well thought and put into designing this course. So all kudos to you, Esther and Vanessa. And I believe that it's going to be a great value addition to whoever takes this course, and also the career opportunities I'm sure are going to zoom up after this learning experience, especially with the internship and the way they can connect with so many healthcare professionals during and after the course. So it's super exciting. Again, if you have any questions, please send it to us. And I would like to thank Esther and Vanessa for being here and answering all these amazing questions for us and creating this interest within us. Can't wait for the course to get started and everyone to have, experience of learning about oncology nutrition, the latest innovations in that field. So thank you so much. And if you would like to add any final comments, Esther and Vanessa.
Thank you. Thank you for giving us the platform.
Sure.
Yeah, and thank you for the opportunity to share all this knowledge with all of you, and I'm sure it's going to be very useful. Very useful.
Yes, extremely useful. I agree with you that I think it's going to be a game changer for whoever takes the course, in the way they are going to look at the whole aspect of oncology nutrition and their career. In fact, so it's amazing. And whoever is on the course, please enroll in the course and pass it on to whoever you think might be, beneficial for the course. And just feel free to connect with us if you have any more questions. Esther and Vanessa are super sweet. They're going to answer all the questions and make sure that you are very comfortable during and after the course as well. So thank you, everybody. And I think we will wrap it up here. And I see questions coming up, but we'll definitely get back to you, everybody. We are running out of time today. We have to end the session here. I know I don't feel like ending it either, but we have to do what we have to do. So we are going to go ahead and end the session, and I will get back to everybody who posted questions to us. Thank you, and have a good night. And Vanessa, have a good day.
Thank you. Thank you, Deepthi.
Sure.
Thank you, Vanessa. Happy holidays.
Yeah.
Thank you to everyone.
Bye-bye.